So you are here for developing healthy interpersonal skills during conflict with William. I'll introduce him in just a second. Let me start. Here we go. All right. So this is brought to you by Integrative Life Network. We do have a few programs, some here in Nashville. We have residential treatment as well as day treatment facilities. And we also have Sauna at Stowe, which is in beautiful Stowe, Vermont. It is a substance use primary facility, residential and detox services there. We'll talk a little bit more about Integrative Life Center, as that's where William is a therapist for us at that facility. ILC is an intimate, privately owned treatment center in Nashville. We are dually licensed for mental health and substance use disorders. And under that umbrella, we can serve eating disorders, men's intimacy disorders, primary mental health, and of course, then that substance use as well. Some really exciting news. We're very, very excited to announce that we are now in network with TRICARE East. And we are taking referrals for that. We are just so excited that we're able to serve that population. So if you have anybody in mind, please go ahead and give us a call. All right, I'm going to go over some CE reminders for you all. So for your attendance today, you should have registered via Zoom and gotten your own unique join link. You please need to use that during this in order for us to track when you've come into the webinar and when you leave. You do need to stay the entire time in order to receive your CE credit for this. You must complete the evaluation. That will happen when we end the webinar. It should pop up on your screen to be able to do the evaluation. And if it does not, please reach out. You also will get an email about that as well. I said that certificates will be sent by December 23rd. What I meant is please have your tests completed by Monday, December 23rd. Due to the holiday, we are taking some time off, Allie and I both, so we will get you your certificates January 3rd, no later than January 3rd. So please do look out for that. If you don't see them by then, please, as always, go ahead and reach out to us. This webinar is recorded. When we do send your certificates, we'll send you the PowerPoint information as well as the recorded webinar, because you're more than welcome to share this and also look back on this. We do get a lot of questions if CE credit is available for recordings, and unfortunately, it is not. Once we get this webinar started, we will leave about 15 to 20 minutes for Q&A. Please pop down to that Q&A section. You all were in the chat section chatting to me about where you're from and your favorite cookies. For questions for William at the end, please put it in that Q&A section below your screen there, and that'll help us out. All right, without further ado, I am going to, I always forget this. Let me remind you, we can't see you or hear you. I'm so sorry. So if you raise your hand, we are not able to respond to you that way. So if you do have just a general question, go ahead and leave that in the chat and we'll be happy to help you. All right, now introducing William. William Feck is a licensed professional counselor with mental health service provider designation. He formerly worked as a school counselor in an elementary school before transitioning to a clinical setting. He is a faculty member and lecturer at MTSU for the professional counseling program, supervising practicum and teaching courses such as theories and addictions. William is pursuing a PhD in clinical counseling at Trevecca Nazarene University and is currently working on his dissertation pertaining to combat exposure, relationship-specific attachment styles, and post-traumatic cognitions as predictors for PTSD. He is trained in brain spotting phase 1 and 2, an intervention he often uses for us here at ILC. And additionally, he is a national certified counselor and certified sex addiction therapist. So I'm so excited to welcome him to this webinar. He's done a couple for us before. He's fantastic, and I hope you all enjoy. Let me go ahead and stop share here, and I'll let William take over.
All right. Hello, everybody. Thank you for waiting right then to get this set up. Thank you, Lindsay. I would say my favorite holiday cookie, it was #1 in that competition, and I hope that won last week. It was, I believe, a sugar cookie with the frosting. That was quite amazing. So anyway, that'd be right up my alley for the holidays. So thank you all for joining us. Like Lindsay announced, this is a webinar on developing healthy interpersonal skills during conflict. And the word conflict probably brings up different things for folks. Probably a pretty heated word in and of itself. And really, I want to expand that word conflict to various situations in which just needs and wants are in jeopardy of being met or not met as well. So I want to kind of also give some background on this in my own journey as a therapist and really making this relevant for us as clinicians. So with that, my primary work with folks is working with individuals, primarily treating addictions. And a lot of times there's along with that a lot of trauma reprocessing work that's very necessary in addictions work. So there was one client in particular several years ago who came to us quite frozen after quite a bit of trauma in her life over the decades. And that frozen state, and if I were to pull from polyvagal theory, kind of refer to it as a dorsal vagal state coming to us and in severe need of trauma reprocessing work. And it's very important for me as a clinician to really zoom out quite a bit with clients, to talk to them about a treatment process and give them a treatment frame, um, really inform them of how therapy is going to be kind of facilitated so they know what to expect, especially with trauma work as well. That's part of the safety and stabilization that we want to provide for our clients. So with that, I can recall one of our sessions, and in preparing for this trauma reprocessing, after hearing about the various traumas that she's experienced, I was really trying to help her to understand that, as far as gold standard therapy goes for trauma reprocessing, there often involves kind of a reliving, a re-experiencing through guided imagery. EMDR has that component, cognitive processing therapy, prolonged exposure, brain spotting, all these modalities that have research and evidence behind them, in a sense, really have you kind of relive those moments um, for an opportunity to really identify and replace negative cognitions, which can really set in motion a lot of healing with reducing distress and helping with some interpersonal relationship issues. And in hearing about just this way in which to reprocess the trauma, especially the re-experiencing, she was quite tearful on hearing that, and really in those tears asked, "Do I really have to relive this? Do I really have to re-experience this, even just in the setting?" And it was quite an emotional response for me too, just hearing just the honestly the fear in going back in these moments to reprocess them. And because of that response on her part, in that moment, I simply answered that there's so much research behind that way, but we can look at what else. What else is there to support a person during that time? That sent me on a journey, really, of looking at modalities of how else can we help a person who's trying to reprocess trauma. And in that journey of looking at the research, looking at various modalities, I found so much research on how important building out interpersonal skills is in, for one, just the healthy processing of trauma, but especially in the ongoing support and maintenance of trauma work as well, and just healthy recovery and living. And so that really opened up my eyes to the importance of, yes, as a clinician, being very targeted towards certain modalities, treating addiction in the way that many of us are trained to do, treating trauma in the way that many of us are trained to do, and as a part of that, really helping them to address any kind of relational patterns and increase their ability to engage in interpersonal relationships in a very meaningful way. First and foremost, to just have well-being in their lives and in addition to that, to really help them to navigate adversity in their life. And so that was one marker in my life that really kind of, once again, had an impact on me, and so many more I could reference, but I'll kind of integrate those throughout the presentation today. But I just want to talk through, and just give you some of that background on my strong emphasis now, no matter what the presenting issue is, no matter what the client's coming in for, there will be, from my focus and in agreement with them, to add in a very strong relational component to the treatment protocol. So with that, just kind of recognizing the foundation of this work that we're going to talk through. All right, so as far as objectives go that were listed on this training, I want to just briefly read over those and then kind of shift into more of the content of the session. So today, during this hour and a half that we have together, really kind of zooming out a bit and developing a framework for identifying experiences that have really contributed to relational patterns, how they're showing up in present day relationships, and how to have an understanding of what's going on there. Also, in moments of relational anxiety, being able to identify and describe what's happening in those interpersonal exchanges in certain key moments. And then many people are probably familiar with this term, but corrective emotional experiences, really understanding how to utilize those therapy and facilitate our clients giving themselves the opportunity for these moments um, outside of session with other folks in their lives. So we're going to go through those. In addition, kind of on the back end of this treatment as well, show some research that is very promising in terms of what's needed when it comes to healthy relational patterns, as well as some practical skills as well that I hope you can very quickly kind of pick up and help facilitate with your clients. So we're going to start off with this framework right here. Some of you might have seen some version of this framework. It's actually based off object relations, which is under the umbrella of psychodynamic thinking. As part of my doctoral journey, I was able to have a psychodynamic class, and that just really added to the ability to recognize how relationships can be a strong component. And so from that, I want to kind of talk about how this is organized, and this will actually be the basis of much of our discussion today. So you actually see in the light blue right here, it starts off with interpersonal relationships. These figures right here are representing actual exchanges between you and another person, or your client and another person as well. Ignore kind of the shapes that suggest a type of sex or gender. Any gender can apply here. But just recognizing that that's what that's symbolizing. The S and the O are in reference to self, and then to others as well. So you can put yourself in this framework, or you can apply it, of course, to clients and helping them to guide through this process. You see in the darker blue section right here, it's saying internal or intrapsychic. And so that's actually referring to how key moments in our lives get in our psyche, if you will. And so from that, they create internal working models, or another way to say that is mental representations. Now, hearing those terms, you're probably now thinking of attachment theory. And attachment theory is largely based off object relations, of, once again, a focus being on people's relational patterns with other people, and how that has so many ramifications today, but especially in the context of when we have certain needs and wants that we're not able to provide ourselves, but we actually really need them to be met from somebody else. Okay? So you also see at the very top past, present, and future. And so this is showing past experiences, how they often lead and affect the present day, which also sets a trajectory for our future as well. So I'm going to briefly go over these. You see the numbering here, and then subsequent slides are going to get a bit more in depth and give you an opportunity also to answer some questions for yourself that, after kind of doing your own work today, don't have to get too deep necessarily, but doing a little bit of introspection here and recognizing how this can be applied to different folks and to different situations. So if we start with number one, this is in the interpersonal and starting in the past as well. There are these key moments we have with people. Now, in kind of being more psychodynamically oriented, I often like to take this back to childhood with folks. But honestly, this could apply to any age that you can think of, but the recognition that these are events that have already happened. So in an ideal upbringing, if I were to take this back to childhood, we have these moments of, and many moments, not just some, but many, many moments of needing support of some kind. That could be our basic needs of shelter, of food, of warmth, of comfort. And then as they progress into more kind of psychological needs of feeling like we belong and we're supported and we experience attunement, which leads to co-regulation as well. And so I know this says it starts off with a negative, but I actually want to talk about the positive for a moment here. So in an ideal upbringing, we have these moments of reaching out and longing for somebody to be with us and to comfort us. And if we're in that moment attuned to, and by attuned, I mean responded to, we see a mirroring happen of when I smile, I see my caregiver smile as well. When I'm sad, I see a look of concern as well with my caregiver. That those experiences are actually internalized within us, and they create a template for what to expect in subsequent interactions that are very similar in nature. And so, if I now shift though to negative, and I'll get more in depth with this as kind of the slides progress, but if I were to shift to an upbringing in which there were times where you really needed somebody, and for whatever reason, we're not necessarily needing to put on labels for parents, good parents, bad parents. But there was a moment in that interaction that you experienced disappointment. You were let down in the way that you were responded to. And in a sense, that moment got in your psyche and created an internal working model for how people can respond to you and probably will respond to you. At least that's the way we think. Um, in future interactions with folks. Okay, once again, that reminds you of that situation. That's the second part. Now, the third part here, kind of shifting into present day, this is where, based off previous experiences, based off lived experiences from the past, um, I have certain assumptions about how I'm going to be responded to and treated in that moment. And that actually, a lot of times can influence the way I show up in that moment. And so that becomes a key part of the work here as far as therapy goes. Now, if I show up in a way that's based off very negative past experience, um, what I'm used to with people. Some people might refer to that as a self-fulfilling prophecy here. And so I'm really kind of assuming you're going to treat me a certain way, and because of that, then I show up in a way where I don't let you help, or I'm kind of push against that help as well. Once again, setting in motion something that I really don't want to perpetuate, but I significantly lack a lot of insight here. Now, there is an opportunity with number four. These are kind of the therapy moments that we all long for of I'm with myself, I'm with other people, and I end up taking a risk and I get vulnerable. I ask for help, or I'm in a situation in which people see I need help, and I'm responded to in a way that is so ideal and so unlike the way I was responded to in certain times, especially in childhood, that it actually allows for a bit of rewiring of my brain and the way in which I expect people are going to treat me and show up. And so while it says positive here, and it certainly oftentimes is a very positive experience in this ideal response from somebody else, we actually see less what we can refer to as splitting happening of people are going to be all bad or even all good per se. And I can integrate and be a bit more adaptive in my way of thinking about how people might treat me. And my confidence actually in people in those moments of need really start to shift. Once again, to be a lot more positive and or what we can call adaptive in a given moment. And so now, and as far as my psyche goes, I have a new and adapted way of thinking about how people might be there for me when I need them, and kind of a restored confidence as well in those moments of expressing need, expressing vulnerability, um, and even making mistakes as well. I have a different anticipation on how people might treat me when they find out I've messed up, I've made a mistake. And so from that much more positive part of my psyche with number five, then we kind of end here with number six of if I can reference, once again, from my actual lived experiences, that people can be helpful. I have restored confidence in other people's ability to help me navigate certain situations. And that's probably going to affect the way I show up too in a given moment. So this will be the framework that we're going to use for majority of the sections that we're going to go through today. So we're going to take this kind of almost number by number, if you will, and get a bit more in depth with this. I'll wrap it back up by showing this chart again, and then happy to answer any questions. But this allows us to put a lot of different situations in this context. But this would be the framework in which, for many of my clients, that I actually kind of walk them through what's going on, especially clients who are working through various types of addiction, mental health issues. That work, while of course is largely focused on the individual, I very much take the motto from a colleague of mine that people do not heal in a vacuum. And so from that true healing where community is needed, it's easy for us to get very individualistic in the treatment approach and not recognize how the way that they're showing up in relationships is actually doing more harm than good. And so it's always about case conceptualization of when do I present this and what point in their treatment. But I do my best to actually really present this early on in treatment because I want, in addition to the stabilization with addiction, in addition to the trauma reprocessing, I want them to have some skills and especially some insight into what's coming up for them in relationships because they're going to spend more time in other relationships than they are with me. And so I would like to set them in a trajectory of healing in those relationships as well. So I actually show this chart to every single client that I have, walk through this process, and actually facilitate in a group setting because I work in higher levels of care. Um, in a group setting, actually take them through an exercise that we're going to walk through today as well. So we're going to start with the past. And a lot of this is referencing what I've already spoken about in terms of how past experiences really can set the scene for some present day experiences, or at least affect the way I show up in more present day experiences. So kind of whatever's comfortable for you when it comes to this, but I would like for you to get a bit introspective here, doing a little bit of your own work to understand how this might land for some of your clients if you were to facilitate it, but focusing on the past here for a moment. And we're going to look at number one and kind of recognizing that number one is referring to actual exchanges between you and another person. And then answering this question right here. How were you treated or responded to in childhood? Especially if we think about certain contexts like this, especially related to seeking support, having an adverse experience, or making a mistake. And it won't take too much time to let you write necessarily, but you can maybe jot something down or at least kind of get it in mind of moments like this. So once again, thinking how there's probably a variety of experiences you can think of, but really kind of getting kind of here in the body of what comes up for you when you think about these moments, even a school day. A lot of times people reference trauma so much or even use the word trauma that for some it can kind of lead them down a certain way of thinking. And I want you to even guide people towards thinking about a school day. Um, a school day might not per se be traumatic necessarily, but there's a lot of intensity that happens in a typical public school, right? Part of that involves evaluation, constantly being evaluated in various subjects. so much when it comes to interpersonal dynamics of who am I friends with? Am I going to get picked for a certain team? Who do I get to sit with at lunch? So many of those things. And once again, I wouldn't necessarily consider them traumatic, right off the cuff here, but they do lead to a lot of intensity in our body. And ideally, in our upbringing, we were afforded the opportunity and even prompted by our caregivers in prompting discussion about what happened in the day. And if you're anything like me, there very much might have been something along the lines of good. Um, but ideally, our parents, yes, of course, honored that, respected that, and sometimes a little bit of facilitation of like, yeah, and what happened. And not just even making it about the content of the day, but also being able to process the emotional toll of the day as well. Um, is that a part of your upbringing, your childhood? Once again, not just asking about the content of the day, um, but also about the emotional toll of the day. So thinking about moments like that. Now, number two is probably a bit repetitive. Not always, and this is where you can find some exceptions here. But number two is building off the first question. And now from those lived experiences, if you were to really think about it and get introspective here, what are your expectations of how people will respond to you, treat you, or even think of you when seeking support, having an adverse experience, or making a mistake? And sometimes people can get kind of very much in the prefrontal cortex of their thinking and be very logical. But this is kind of back here, kind of thinking where we can really operate from a very emotional place within us. And so if you're facilitating a question like this, once again, really shifting people to be in the body, which might be an odd concept for some clients, but really speak from the body when you go to answer this. What are expectations of people in these moments? Okay. Now, I want to interject this slide right here when it comes to trauma and interpersonal problems and say that a lot of times, we as clinicians, we're very intuitive in the context of, guiding people towards healthy relationships and community and developing a support system to aid in whatever they're trying to address with us one-on-one. I do think it's important sometimes to take them back into these moments of actually helping them to be validated in why it's so hard to trust people, why it's so hard to engage with people and seek out their support. I think we're all correct in that kind of guiding, that prompting to do that with our clients. But sometimes we hit so many walls with them just repeatedly saying, well, I didn't call anybody. Um, and from that of it's just too hard to kind of share what was going on. And that's when I think we're starting to hear red flags of there's probably some lived experiences of childhood, adolescence, earlier years in our lives where there were some moments that really created some pretty negative mental representations for people in that context. Now, what I have referenced up here on this slide comes from the work of Markowitz, who is one of the developers for interpersonal psychotherapy. That was originally designed, created to address major depressive disorder, but actually more recently adapted to address post-traumatic stress disorder. Now, I'm not going to get too much into that modality, but I will just simply say that modality is one of the alternatives to trauma reprocessing that has increasing research behind it to support people. And it's a modality that's very relational in component and does not require people to actually to re-experience their trauma through guided imagery. And so this became actually one of the modalities that came up in the research with people who just really were asking, hey, is there another way for this trauma reprocessing? From that research, and even the work of Shapiro from EMDR, there's a lot of recognition that people who suffer from PTSD also have a lot of interpersonal problems. And so these are some of those problems listed here. They're kind of detached from their emotions, from their body, from sensations. Sometimes that's more from a dorsal vagal sense of kind of frozen. Sometimes that comes from addiction of engaging in compulsive behaviors to kind of numb out, avoid, and distract themselves. But also there can be this mistrust of the environment, as well as this distrust with people. And there's a constant, can I trust you? Are you safe? Those sorts of things can often emerge with people. So I think as we're prompting people to really engage in support seeking, um, from that place, recognizing when we're hitting walls, experiencing barriers, there's probably a lot in the background that needs some attention here. And I think that that can be very validating for clients to give them that insight into what is that about? What are all these barriers here? And that warrants a different type of treatment at that point or something to supplement through EMDR as well. Now, when we kind of shift to the present, building off that framework here, number three is kind of staying with the negative, and then we'll shift a bit to corrective emotional experiences. But thinking about when we are hitting those walls, those barriers, just experiencing support, um, answering this question right here. Based on your expectations of others, how do you show up in relationships? And I often just say that pretty ambiguously to clients to let them kind of take that where they need to take it, but it's very much in the context of when you need support, when you've made a mistake, um, things like that. So the second question, how might your actions be based on anticipated responses from others that are preventing a healthy relationship? So this gets in the kind of similar concept of self-fulfilling prophecy of if I actually assume that you're going to invalidate me, that's probably going to be very indicative of how I hold back in the relationship, how I don't actually be vulnerable with you, which leads to a lot of different interpersonal struggles in those moments. If so much of my behavior, how I'm showing up in a relationship, is based off my assumption of how you're going to respond to me. When I often say that to clients, that often gets them a little bit wide-eyed in terms of recognizing how they have, unfortunately, and we so often do this, but unfortunately, how many of us have carried our old experiences into present day relationships. And this is when the conversation happens with clients of how you did not, whatever relationship they're trying to work on, sometimes it's a new romantic relationship, you did not go into that relationship with a blank slate. It might be a new person, but our brain is very much projecting on them based off the past. And even if in the beginning we kind of tell ourselves they're so different than other people that I've been in a relationship with, they're so different, they're so much better. Over time, a lot of times those unresolved experiences and dynamics will emerge in that relationship. So sometimes it's just a matter of time. And so that's where I think it can be very important, if you're kind of psychodynamically oriented, to recognize, to look back into those relationships where there's a bit of unresolved as well. Now, I know if you're CBT, that's often where you don't take it necessarily, just kind of work on the present. And I think that object relations, which this is based off, it is very complemented by CBT eventually. And we'll get into that in just a moment as well. Okay. But shifting down number five to this lower end of the slide, if I'm showing up in a way that's more consistent with past negative experiences, I'm often going to get a pretty unpleasant interaction from a person as well. And so I want to talk about how we might show up in moments where, we're just kind of assuming that they're going to treat us in a way that's not ideal. So these three responses right here to relational anxiety come from the work of Karen Horney. She was in the time of Freud and doing very psychodynamically oriented work as well. But these three concepts came on the scene and often used today. Even the VA uses this quite a bit if they do any kind of couples work. with veterans and their spouses or partners. And so I'm going to briefly go over these, and I think it's very helpful for clients to really identify the predominant way in which they're responding very anxiously in certain interactions with folks. So some of that includes moving towards. This consists of in moments of confrontation, even in moments sometimes of support, but it feels a bit scary to be called out, if you will, of someone recognizing, hey, we're not okay, something's going on, that we can eventually shift into very placating responses as well, just kind of hear whatever or say whatever a person wants to hear, that we're assuming that they want to hear, to basically get them to be quiet. Um, that's something sometimes to really address with clients of are you so have you adapted so much in your character that you know exactly what someone wants to hear, and that's so much of how you respond in the conversation, all for the sake of peace. But really, if we get down to it, the absolute fear that you're going to be abandoned a lot of times out of authenticity, right? A lot of fear of disconnection with folks who engage in moving towards in relational anxiety. The other one, moving away, could be likened to a fight response. If we would think of dorsal vagal, like a sympathetic response, um, excuse me, a flight response as well, of kind of in a moment of relational anxiety, I find myself needing a reason to leave the conversation, to walk away as well, because I'm so overwhelmed by what's going on, even if it's just slightly elevated voice or slight um, intensity when it comes to someone asking me, "Hey, what's going on? You don't seem okay." And then moving against would be the, as I referred to earlier, but meaning this one, kind of a fight response as well. So still sympathetic, not a flight, but a fight response when it comes to moving against. This is where a client or ourselves might find us raising our voice, name calling, using sarcasm. And then unfortunately, it could escalate beyond that and actually get physical. So many people ask, well, I kind of engage in a blend of this. And Karen Horney was very aware of that we have different tools that we use in relational anxiety. We might even have kind of a hierarchy, if you will, of shifting to them in certain orders. But from her perspective, a lot of us have a predominant way of showing up in moments of relational anxiety. These actions can be barriers to actually experiencing intimacy with another person. If I'm just telling them what they want to hear, if I'm running away from the conversation, and especially if I'm fighting my way through the situation or away as well. So helping clients to identify this, there's a lot of research that you can look that will add depth to these concepts as well, but it comes from the work of Karen Horney. Now, now with this, just kind of reminding ourselves that if I have those interactions, I'm often going to be reinforcing. If I'm especially moving away and moving against in those moments, I'm probably not going to bring out the best in people. And it's going to just solidify that they're not safe, that they can't show up, that they can't help me in those moments. And so that just repeats the pattern, and I keep, no matter what relationship I get in, same relational patterns end up emerging. Now, I have an opportunity in therapy and honestly in every interaction I have with somebody of experiencing the opportunity for a corrective emotional experience. So I often like for clients to actually really take some time to describe the most ideal way a person could respond to them in moments of seeking out support, to really just kind of get in their mind, what do they need in those moments? And from that place, really begin talking with close people in their lives. Could be a partner, could be a spouse, could be friends, could be people they're in treatment with as well, of learning how to communicate what do they need in those moments. So not just putting people on the spot and just hoping that they respond in an ideal way, although that can very much happen, especially in therapy, of just our warmth, our unconditional positive regard, really facilitates this very organically. Sometimes, though, it needs a bit more prompting. And that's the opportunity for clients to begin to be very vulnerable and request that they're responded to in a certain way. Obviously, not in the context of trying to control, there's choice, but these are asked sometimes with their partner. And when I'm afforded the opportunity to receive that ideal response, a lot of times I end up engaging much more authentically as well. So from that, I might find myself much more vulnerable. I might find myself asking for more support. Um, could be something like, hey, just can I talk to you about what's going on? Even when I'm asked, hey, are you okay? Something seems like it's going on. That becomes more of a safe question because I am actually going to take the chance um, to see if they can show up in an ideal way. Now that takes work though for a couple. Okay. So with that, but if I'm awarded that opportunity for uh, a corrective emotional experience and it begins to kind of shift my internal working model of people, especially in that setting, and my mental representations of people shifts, becomes much more adaptive, then a lot of times, as far as the future goes, I'm going to anticipate that people are going to respond to me in a much more favorable way. Once again, not in a way that hopefully promotes splitting of people are all good, people are always going to do what I want. That's where the splitting and integration work needs to take place as well, but a much more adaptive way of thinking. So we're promoting this within our clients, both within session and helping them in certain moments to recognize um, how they need to focus on their behaviors as well and give people the opportunity to support them. Okay? Now, I want to tie this back to this framework before we shift into the next part here. But I do believe that this is a very two-pronged approach with people. With the interpersonal, if we just look at that horizontal line right there, I believe it's very important to, as clinicians, especially if you have the opportunity for group work, group counseling, or higher levels of care where there's just a community always there where you can facilitate these moments, facilitating quite a bit of work where people have the opportunity to be vulnerable with each other and experience concepts, even like Yalom talked about, of universalization. And that allows for quite a bit of corrective emotional experiences by being with people, being vulnerable, and really seeing their responses as well. And I quite often facilitate when people are very vulnerable in a group setting to actually have that client make eye contact with people in the group and to even comment sometimes, what are you seeing in their face? What are you noticing? What's coming up for you as you make eye contact? And it helps so often to do some rewiring for a person to realize that that shame that they've been carrying, they actually are being met with so much compassion from other people. And that in of itself becomes quite a corrective emotional experience. Okay. The other prong here that I'm referring to is focusing more on the introspective process. And while certain modalities like EMDR, brain spotting, some adaptations of IFS certainly do have an interpersonal or relational component, but a lot of times you are reliving certain experiences and addressing them based off the nuance of that modality with cognitive interweaving with EMDR. Sometimes there's safe person imagery. Sometimes there's an ideal parent figure protocol. So there are various nuances to the way you address what's going on as far as the internal working model goes. But I believe that as clinicians, when we're trying to address relational patterns, we're both trying to prompt actual lived experiences, engagement with other people, in the intrapsychic work of really having them go internally and reprocess some very adverse encounters with people, which really set the scene. And I've seen when people have the opportunity to do this work simultaneously, it leads to very, very efficient outcomes. Sometimes that means two therapists, sometimes that means two therapy sessions a week. Doesn't always have to be that way, but I do see people who are able to engage in both types of work here, it really sets a scene for quite a bit of healing as well. Okay. So from that, I want to shift and be a bit more kind of focused on some other research and be a bit more practical in what folks can do. And certainly this might be more in the context of romantic couples, but this can be applied to many folks as well and many different relationships that people can think of. Now, let me talk just for a moment here before we shift into the next slide with a research behind it. But when it comes to developing any kind of relational patterns, there is that work within oneself that needs to be addressed, that intimacy with oneself that really needs to be fostered and cultivated, especially in the context of a person getting to know themselves. Now, I work with a lot of folks addressing addiction. And with addiction, there's a significant amount of kind of disconnecting from oneself, where emotions are often experienced in the body. And from my case conceptualization, at least, I think that there can be nuances and differences of opinion when it comes to etiology and why addiction is sticking around. But from my viewpoint, I very much view any type of addiction as a way to basically, simply put, change the way that you're feeling. It can be very distressing to experience anxiety, to experience sadness. And so there are these attempts that people have, whether it be through substances or even behaviors, when they're engaged in repetitively, as an attempt to not feel what they're feeling. Right? Now, that might happen through numbing, can also happen through ecstasy, through joy, through euphoria. So there can be various ways in which you're trying to change your feelings, but simply put, trying to change the way a person feels within themselves. That when you're living a life of avoiding certain feelings, it makes it very difficult to have any kind of intimacy with somebody else. Um, if I don't know what I'm feeling, which is what it often leads to, because the slightest bit of discomfort, I'm going to try to numb out, per se. If that's what I'm engaging in those moments, then a lot of times when I'm asked, hey, how are you? Or hey, what's going on? You seem like something is off. In those moments, I'm really not going to know how to answer. And that really comes from a place of I don't know myself. I don't have intimacy with myself. So a lot of the work that I do is very somatic based. And as clients are talking, really shifting them into the body to notice what's coming up for them. And through a lot of prompts like that and establishing safety to go inward, them growing in their dialogue and building their emotional vocabulary to actually seek out the type of support that they need. Now, I want to shift a bit here. We'll come back to what I'm talking about, but how important it is in those moments of being vulnerable to attunement. This comes from the work of Dumas, a French scientist, who, through what a technique he referred to as hyperscanning, a bit above my pay grade in terms of the technicality of that, but this process right here has to do with right brain thinking, much more of the emotional side of our brain and much more in tune with nonverbals as well. So this was an actual experiment with two folks looking at each other and engaging in nonverbals such as hand gestures, and the other person would actually mirror the nonverbals as well. And there was a lot that went into this study, but the point that I want to make is how kind of synchronized brains get even with nonverbals. Now, if you're interested in this, I'd highly encourage you to read the work of Dr. Alan Shore, who very much is aligned with Dr. Dan Siegel when it comes to interpersonal neurobiology and what can also be referred to as two-person psychology, two-person neuroscience as well. But all of this getting at the point of how very much attuned we are to other people, and it's not always about our words. We cannot make it always about saying the right thing because that often gets people on edge of, well, I don't know what to say in moments of, I see my partner's in pain, I see that they're hurting, I see that they're sad. What do I say? You know what? I mean, sure, words absolutely matter in those moments, but if you really want to get in sync with your partner, show them. Show them especially through your face, through your body posture, that you are so responsive to their sadness. If they're sad, them seeing that sadness on our face too in response to them is one of the most healing things that a person can experience and lead to what Alan Shore referred to as feeling felt. When we are sad and we see other people show sadness out of empathy on their face, even when we're happy, we're joyful, and we see joy on other people's face in response to our joy, that gives us a sense of feeling felt and recognizing we're not alone, we're supported, we're attuned to, and it allows for the process of co-regulation, meaning I'm no longer engaging in substances or behaviors to try to take away my feelings. I'm actually, through confidence and safety, taking my feelings towards a person and letting that conversation, letting another person hold space for my feelings because they're with me in what I'm feeling. Okay. The other thing that I want to get to is just really building the evidence for helping people to build an emotional vocabulary. So this was another research study done utilizing an fMRI. And in particular, what they were giving attention to is the amygdala, which we know is kind of nicknamed the fear center of the brain. And what they did while people were in an fMRI is they were actually showing them very negative images of people. And they wanted to see, basically speaking, what decreased the response of the amygdala, what kind of calmed or deactivated the amygdala the most. And so you see these down at the bottom under these under the bar chart right here. Affect label, affect match, gender label, gender match, observe. Um, what they found with this is that a person, when they see an image that's negative in content, so if they saw a picture of a person kind of screaming, like looking very scary, if they had the ability to actually label and say, oh, that person is angry, that actually calmed down, deactivated the amygdala the quickest. So, meaning if I have the ability to actually be perceptive towards other people's feelings, that actually establishes safety within myself. Because sometimes the issue, as we all know, probably personally and with our clients, is that we encourage them, yes, to seek out their own support, but it goes both ways. People come to them sometimes with support. And it's not uncommon that a person can get highly dysregulated in their attempt to support somebody else. And so from that dysregulation of you're angry, now I'm angry, or I'm like terrified now, I'm not even able to attune to you, I'm not able to be with you. And so from that place, I'm maybe engaging in a move against response or a move away response. But basically, I'm not in ventral vagal, if I'm thinking about polyvagal theory here. I'm not in ventral vagal, I'm not able to socially engage with you, and I'm not able to actually help you to experience co-regulation. So even though it seems so foundational, almost to the point of an eye roll for some clients, it is so important that they get used to for themselves being able to identify what they're feeling in their own body, to have a very strong, built out emotional vocabulary that has nuances to certain feelings as well. But I really think just really just basic feelings can lead us down a path of healing as well and help us to have safety as we're attempting to support somebody else, okay? Which in turn can allow us to be supported in those moments, okay? Now, I talk about that because a lot of times people need structure as well to have difficult conversations. I know not everybody here probably is necessarily working with somebody who is addressing various addictions, but there can be mental health issues that a person's having, and they need an opportunity to have difficult conversations. And what I would encourage anyone to facilitate for folks is to minimize asking questions about difficult topics, especially when a person is struggling with mental health issues or addiction issues, helping their partner to understand spontaneous questions about how are you, what's going on, what do you need. It's amazing to me they're such loving questions, like I just referred to. They're very supportive questions. They're also a lot of times very overwhelming questions. Even being asked by loved ones, how are you? Or you seem off, what's going on? Those can be very overwhelming questions for a person who's not at a place of or used to communicating that. So I oftentimes like to really prompt this format right here for Phanos. This actually comes from the work of Lasser as well, who really needed some type of format for her and her husband to talk through things as he was struggling actually with the sex addiction on his part. And so she created this acronym, Thanos, coming from the Greek meaning to come to light, and allowing them a very structured opportunity to talk through these things. So I often encourage typically speaking, the men that I work with and their partners who often get the opportunity to have weekly phone calls with to really implement this if they're at a place of having conversations. And a lot of times this turns into once a week conversations. Obviously, they're with each other every day, going about their day. But when it comes to certain more vulnerable topics, it's the request, especially early on in recovery, to put some structure in place to help kind of tone down any hypervigilance, which might be created from being asked spontaneous questions such as, what's going on? Where are you at with your sobriety? So, from a place of having structure, both in the format and in the time, when are we going to have conversations like this? Thanos can be implemented. Once again, something that you can very easily find as well if you were to Google it. So, we're going to start off with feelings. Um, you share with your partner a feeling that you have. A lot of times it really is helpful to give people a feelings wheel or a feelings chart. Um, People a lot of times really lack the ability to communicate about their feelings. A lot of times they might share their thoughts. And it's like, no, we're not sharing thoughts, we're sharing our feelings. And so giving people something to reference in those moments. Affirmations, of course, are very helpful for partners, basically affirming something that they've seen them do this past week. Needs. State a need that you have today. Doesn't always mean your partner has to be the one to meet those needs. But I love getting clients to ask their partner, if their partner is willing to be asked, if they're at a place to do that, to ask for things. And I think that there's a couple of things that go with that. For one, needs, you actually asking for your needs to be met or expressing your needs actually demonstrates worth. Demonstrates no matter what I've done, I'm still a person. I have my basic needs, I have my psychological needs, and moving up Maslow's hierarchy of needs. But I am willing to be introspective and acknowledge that I have things that I need that I probably can't do for myself or don't need to do for myself. And the other thing that that communicates is it actually communicates confidence to your partner, especially if you are asking your partner for something. It communicates, hey, I have confidence that you can provide this for me. So it's reinforcing this worth within the person, and it's communicating confidence in the other person, which once again is a very important component of a healthy relationship. The other part here has to do with ownership, taking responsibility and apologizing for something you've said or done. There's probably many times throughout a day or throughout the week where this might be applied, but very intentionally done of how a person recognizes that they are human as well. Unfortunately, when it comes to sometimes mental health issues, and especially with addiction, one person turns into the bad person or the bad guy. And it is very important for all parties to not be blamed for those things, but to recognize just humanness in the relationship. And so ideally, both parties are willing to take some type of ownership for something. Okay. Does not have to be in the context of mental health issues, does not have to be in the context of addiction, but just something. And I'll give you some examples as well in a couple of slides. Okay. And this also ends with struggles in sobriety. Have an opportunity to tell your partner the status of your struggles, sobriety, recovery today. Be specific, but not graphic. And this really is preparation that's needed of what does your partner want to know when it comes to certain struggles that you're having. Sometimes a partner is not at a place to hear certain content due to sometimes their own betrayal trauma or trauma of any sort. Maybe that it just brings an intensity within them and they're not able to hold space. So that needs to be a conversation of what can I share in this moment about certain struggles that I'm having, especially if it's related to sobriety as well. Okay. Now, harping a lot here on emotions, and talking a lot about getting people in their body, especially thinking about feelings. Out of that whole chart, feelings does tend to be the one that can be the most difficult for clients to communicate, to us and a lot of times to their partner. There can be various reasons for that because maybe their partner has told them they don't want to hear what they're feeling or don't care. So there can be various things that they're referencing for why, but even when they have an opportunity to express their feelings, it can be very difficult. And especially when a person has lived a life avoiding, numbing, and distracting themselves from their feelings, it's very important for them to develop intimacy with themselves, to get very well acquainted with what's happening within their own body. And I will say this, emotions are such an abstract concept. Emotions, if you ever thought about it, emotions are something that we can experience all day long and probably do experience all day long and every day. And to me, kind of the crazy part of that is that emotions are invisible. You're experiencing something that can be very overwhelming and distressing, and you'll never be able to see it. And so there's this invisible concept that we're experiencing at all times. And in an ideal upbringing, um, as we, as children, communicated certain feelings, probably through sensations of like, oh, I have a kind of a sick stomach. Ideally, a caregiver would have been like, oh, are you nervous right now? Trying to help put meaning to what a person is experiencing. Or a kid is kind of like hunched over, showing kind of like sadness on their face, but they don't know that they're sad. And a caregiver, a teacher, or something like that, it's like, oh, are you sad? And the kid, boom, it's like, oh, there's a word for what I'm experiencing in my body. And the other thing that children do is it's not just, oh, I have a name now, which can be very helpful, but I'm also looking at how this caregiver who's stronger than me, who's maybe wiser than me, a source of protection for me, they are actually calm. Like I'm anxious, and they look like that's okay to feel that way. And so I'm actually also absorbing their appraisal of the situation. So it's establishing safety within myself that I can actually be sad and that's not anything to freak out about. And I know that because my caregiver is not freaking out when I'm sad. And I don't mean invalidating, I don't mean they're like, get over it. I just mean they're with me. And I learn how to kind of ride out the wave of what I'm feeling. Okay. Now, I put this picture in front of you and have talked for a few minutes and not explained what it is. This is one of my other favorite studies to show clients and to use, especially in group settings. And this comes from the work of Newman Ma and colleagues from back in 2013. No fancy technology was used. This is not any kind of body scan. Simply put, this was 700 participants who were given an emotion word here, and they were asked to color in with these body outlines, these silhouettes here, where they experience these emotions in their body. And the various colors that are used are actually representing kind of a feeling of intensity and then vice versa, not feeling much. And so you see emotions like happiness and anger. You see there's a lot of feeling, a lot of intensity with those emotions. You see, like depression, though, you actually see a lack of feeling. And so when we have clients who actually say, I feel nothing, that can be a significant sign of depression. And so the other thing I'll say with that is when I have clients who actually say they feel nothing, I actually tell them that's actually a feeling as well. And so I even ask questions like, well, where do you feel the most nothing in the body? And so getting them to recognize even that needs to be followed and paid attention to. But with this, with these 700 participants, and I'm trying to also recall, I believe it was in Europe and then Asia where these participants were, but it really shows how emotions are experienced primarily, yes, in the head, but so much in the torso of the body. And so it's very important for people to get really acclimated to where they experience emotions in the body. And so as they're experiencing them, they have a growing ability to communicate to themselves, first and foremost, what they're feeling, to interpret what they're feeling. But very importantly for relationships, they can interpret and communicate to their partner how they're feeling as well. Because a lot of times partners actually pick up on feelings. They see a clenched fist, they see a dry mouth, they see kind of eyes looking down. And the person who's actually feeling is largely unaware. And so sometimes it takes getting very foundational and teaching people sensations that can be interpreted as certain emotions as well, all for the purpose of helping them to communicate it to their partner, to experience attunement from their partner, and to ultimately experience co-regulation from their partner as well. So I think that this is very important work with clients as well. And with those feelings, we really want to shift people away from saying, I feel like, because they're not about to express an emotion if they say like. I feel like. They're about to then express a judgment. I feel like you don't get me, which is not a feeling at all. They're basically saying, I think. So we want to help people shift to I feel and actually express an emotion in that moment. So anytime I have a client who says, I feel like, I kind of, with their permission, kind of give them tell them to pause and say, you're probably not about to tell me a feeling. So let's kind of shift. I feel what in my body. Okay. Now I want to close out here by giving you an example of Thanos as I kind of talk through various components of feelings. So in that moment of sitting with a partner, saying feelings like, I'm a little scared but hopeful. I often feel fear, thinking about whether you're taking recovery seriously. Affirmations might say, I want to acknowledge and thank you for doing the dishes today. Needs might sound something like, I need recognition from my boss. I helped solve a problem from the company last week. So not always a need, excuse me, from the partner. Ownership. I take ownership over my financial issues with spending. And then lastly, could be struggles. I practice healthy eating habits all day while I have occasional periods of desiring unhealthy foods or making progress and being more honest about how I've used food to cope with my feelings. So there's an example as well of Thanos. Those are not always related. It can be separate sections as well. So thank you for this. I think we have some time for some questions as well. So
Yeah, this was great, William. Thank you. All right, let's get to the question section here. The first one is, please say the trauma treatment modality again. Was it IPT? I think people didn't hear you at the beginning.
yeah, absolutely. Interpersonal psychotherapy. So IPT, like I said, originally designed for major depressive disorder, but you can also type in IPT-PTSD, so IPT for PTSD.
Thank you. And then Charles said, this is very similar to the cognition to cognitive distortion of mind reading or fortune telling.
Yes, absolutely. So this is why I think object relations and cognitive behavioral therapy very much complement one another of getting into basically mental representations, and very much like CBT calls it mind reading and things like that.
Right, the next question. What would have been an effective way to assist others in identifying feelings? Some people can identify what they are thinking, but not always what they are feeling.
Yes, absolutely. So there is a term that's used. I think it's important that the term's not overused, like we can do sometimes. But alexithymia can be the term that's used when people have an extreme difficulty really experiencing and growing in awareness of their emotions. Emotions are just so abstract to them; they have a hard time connecting, and especially a hard time being able to communicate it as well. So with folks, I think it's very important to actually just focus on sensations. there are so many clients where I actually say, you know what? Let's ignore, don't tell me feeling words. I feel this. Just tell me sensations. And it might even start off with physical sensations like, I'm going to be very random here. My knee is sore. Great. You're in the body, you're growing an awareness of your body. And let's kind of shift that to the stomach. What are you experiencing in the stomach? What are you experiencing in the chest as well? And then as they grow in the ability to communicate certain sensations, that often leads into an interpretation into feelings as well.
It's great, helpful. In the bodily map of emotions, are the illustrations shown related to the chakras in any way?
That's a great question. I don't think so, but I love anyone who's just really specializes in that to actually kind of see if they can see if there's a pattern there.
I loved that map. It's like you said, it explains it so well. To really visually
Mhm.
see that is I think very helpful.
Absolutely. Yeah,
All right, one last question here. Ken asked, I find that a common barrier in communication is the belief that judgment and criticism can affect change or help a person get needs met. Can you give recommendations on how you might effectively intervene with this dynamic?
absolutely. So a lot of times when a person has one relationship in mind of where they want and try to get all their needs met, um, I think it's very helpful to actually shift people temporarily. Please hear the word temporary. Temporarily learn how to get their needs and wants met from their community in a more distributed fashion. So, once again, working in addictions, a lot of people go to 12-step meetings. Learn how to actually ask for support and to get some of your needs and wants met um, from your sponsor, from your 12-step meetings. If you are religious and go to church, temple, synagogue, learning how to ask those sorts of people as well. Giving yourself the opportunity to be in other relationships. From that place, it often does some rewiring of realizing that people can be there for you, people can support you. And that a lot of times leads to a healthier, more adaptive mindset in relationships. And even if us having human relationships and a human romantic partner, they are going to disappoint us sometimes. But then we're not shifting into kind of splitting of saying, see, this is why I don't ask for your help. We can actually hold space and say, maybe they're having a bad day. Maybe this is just too difficult for them. So I'm able to, in a more integrative manner, kind of hold space for their response and then give them other opportunities later rather than kind of write them off.
Fantastic, thank you. Well, if there's no more questions, we are going to end a little bit early. Just wanted to remind everybody to please fill out your evaluation that will be sent to you right after we conclude here. We will send out certificates as well as the recording of this and the PowerPoint presentation along with your certificate on no later than January 3rd. I just want to take this opportunity to say thank you to William so much. This was just very reflective and insightful. Also to everybody who's on here, thank you for a year of support. We are so grateful for you all. Happy holidays. I hope you get some rest and relaxation with you and your families. And we hope to see you in the new year. Happy New Year, and we'll see you soon. Bye bye.
Thank you, everybody. Bye.